Hi Jenna, I watched your cardiac and lung assessment video and decided to do one of my peer reviews on it. I thought you did a very good job of your initial encounter, and I really liked that you added the full neuro assessment into this assessment video. I think with any assessment, it's important to make sure that your patient is alert and oriented before beginning, especially when you're going to be asking them subjective data. You want to make sure that they can answer it correctly or honestly, and they know what they're talking about. I thought you did a good job of collecting the subjective data. I actually thought you went above and beyond in this area. You asked questions I wouldn't have even thought to ask in my video. I think that's definitely a good skill to have in the clinical setting, and it would be very beneficial to you and your patient. There were only a couple of constructive comments I had for your video. The biggest one being that at some points I could barely hear you talking. Maybe bringing the camera closer or talking a little bit louder if you're going to keep it further away would help, just so that whoever's watching your video doesn't think that you missed something just because they couldn't hear you say it. I noticed that when you were listening to the lung sounds on the posterior chest wall, that you listened down one side and then down the other side. It's important to listen to each sound bilaterally, so one area on the left side and then on the same area on the right side, and so on. So you'll notice any differences in those areas. I also noticed there were just a couple things that you missed in your assessments. You didn't check for edema or crepitus in the patient's skin. When assessing the lungs, you didn't check for tactile firmness, which will be important when checking for fluid or abnormal tissue in the lung field. And lastly, you did not verbalize that in a real assessment on a real patient that you would check the femoral artery pulse. There's just a few small things that you missed, but otherwise I thought you did a very good job on your video.